Hello, everyone. Welcome to the Preemie Chats, and thank you all for joining us here today. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation. CPBF is a charitable organization, and our mission is to support and educate families of premature babies. This Preemie Chat series is one of the many initiatives we have to bring information for NICU families and healthcare professionals. Here every Friday, we talk with experts, researchers, and parents who share with us their experience and knowledge. Also on our website, canadianpreemies.org, parents will find all kinds of resources and support. And today is Pregnancy and Infant Loss Awareness Day. And we have three guests on this Preemie Chats. We'll be talking about how to provide palliative care throughout the perinatal journey, as well as why it's important to raise awareness about pregnancy and infant loss, and what supports are available. So our first two talks will explain how palliative care is much more than an end-of-life care. We are going to showcase two palliative care teams and how they provide an extra layer of support for families. From the moment families receive news of life-threatening diagnosis for their baby, perinatal palliative care can support families through their decisions and experiences during pregnancy. After birth, palliative care focuses on quality of life and explores ways for families to make memories and find joy in the intensive care setting. And I have here our first guest, Dr. Sarah Lord, who will present the IMPACT program, Infant, Maternal, Paediatric Advanced Care Team, and its support during pregnancy. Dr. Sarah Lord is a staff physician in the Division of Pediatric Medicine at the Hospital for Sick Children in Toronto. Dr. Lord's main clinical work is with the Pediatric Advanced Care Team, PACT, at Sick Kids. She's a physician leading perinatal palliative care and serves as a medical associate within the Department of Bioethics. Dr. Lord, thank you so much for joining us here today.
Fabiana, thank you so much for having me. It's really my privilege to be here to share some of the work that we've been doing, and in particular to mark this occasion of pregnancy and infant loss awareness. So thank you so much.
Thank you. So we have a presentation to share with us. I will let you share the screen. And for all of you watching us live on Facebook or YouTube, please send your questions, your comments, that we're going to address them at the end of Dr. Lord's presentation. So the floor is yours.
Thank you so much. So I wanted to just spend a few minutes explaining a little bit about our program, because I think perinatal palliative care is something that's emerged over the last 20 or so years. And in particular, our program, although we've provided palliative care to families prenatally as well as babies for a long time, we really didn't have a formalized program until fairly recently. And it's really been a privilege of mine to get to work on this with a lot of experts in different areas and try to continue to figure out how do we best provide supports to families. And so some people may know that back about 6 years ago, Bill 141 was passed in Ontario. And that was a really momentous time where funding was prioritized for really research and program development in pregnancy and infant loss. And so some of that funding was part of the reason that this program was able to come to fruition. And so we've had a few name changes along the way, but the one we've settled on over time is IMPACT. Fabiana mentioned that the team that I work on at Sick Kids, which is the palliative care team, goes by Paediatric Advanced Care Team. And so it was natural for us to create a team that was sort of an offshoot of that. So we go by the Infant, Maternal, Perinatal Advanced Care Team. And I should say that our work is really a collaboration between Mount Sinai Hospital, Sick Kids in Toronto, Emily's House, which is our children's hospice in Toronto, with support from the Toronto Central LHIN through the Ministry of Health. Really, the things I'd love to be able to touch upon with you and hear questions related to as well is just acknowledging that this day by sharing a little bit about this program, really to give you a sense of what the care pathway looks like and how we individualize it for different families, and to talk about some of our hopes for growth of the program. And that's where I'm always open to input from people who are passionate in this field. So the goal of this program when we started was really to take the work that was already being done, but to really streamline and enhance it so that we were providing equitable opportunities for palliative care support to all families who experience a life-threatening fetal diagnosis, regardless of their care choices. So recognizing that there are roles for palliative care in different situations, including in a neonatal intensive care unit or babies who receive diagnoses after they are born. The focus of this program really was families who experience a diagnosis prenatally, particularly in some other parts of the world and in the US where perinatal hospice sort of emerged. There have been programs that tend to be more focused on really following families once they've made a decision to continue their pregnancy and take a comfort-focused approach to the care of their baby. But we really wanted to step our support back to more, to be more inclusive of families regardless of their care choices, because we know that there's lots of that can change. There's lots of things that happen in spite of what a family's hoping for or planning for. And so there can be room for palliative care in different scenarios. So our hope is to be able to support decision-making when families receive a difficult diagnosis. And when I say difficult diagnosis, you know, these are some very severe life-threatening issues that families might find out about. And they're ones where there often isn't an ideal option or a fix that's clear that all people would necessarily choose. And so you can imagine that a family going through a diagnosis like this, you know, their minds are reeling, trying to figure out what is possible, what is recommended. They get counseling from many different subspecialty providers. They're forced to sort of examine their own values and beliefs. There's often a degree of uncertainty or unknowns about exactly what will happen with their own pregnancy and baby, particularly when a baby has a life-threatening diagnosis. And then I think all of this comes down to really people at a really critical time, which is relatively short, a pregnancy, to reflect on what it means to be a good parent. And for some people, particularly if it's their first pregnancy, they're making those really complex decisions and reflections when they haven't even had the experience yet of being a parent. And so we want to make sure that people are really well supported. Our clinical team involves a clinical nurse specialist by the name of Lindsay Pollard at Mount Sinai Hospital, who has a lot of experience in walking through challenging situations like this with families. We have grief support through Emily's House as well as Sick Kids, and then myself and a nurse practitioner on our pediatric palliative care team here at Sick Kids. And so the way we try to incorporate ourselves really evolves over time, and we try, as I said, to individualize it for the family. So first, a family obviously receives one of these very tricky heartbreaking diagnoses, and really they're diagnoses where the outcomes for the baby are considered severe enough that although there may be interventions that could be done to help prolong a baby's life, it would also be ethically reasonable to allow a baby to have what we would consider sort of a natural death, although I don't love that language, but to die after birth and not necessarily have invasive interventions done. And so a referral comes to our team. It often comes from the obstetrician, or if they have already been sent to the special pregnancy program at Mount Sinai following diagnosis, then sometimes a maternal fetal medicine specialist or neonatal subspecialty teams. And then we really get into helping to support what those teams are doing. So thinking about pregnancy care planning, thinking about grief support really early, and then pediatric palliative care support as it's needed. And so our clinical nurse specialist at Mount Sinai will meet with families early on, start to talk about what their goals of care are. And in thinking about goals of care, how do we actually translate that to what the care in the pregnancy should look like? What kind of interventions are important in the labor and delivery room? How do we honor that baby's life? How do we care for that baby? What does that actually look like? And then if the baby is living after birth, what does that early neonatal period look like? And how do we guide families as to how it should look based on what their goals for their baby are? Grief support, as I mentioned, I think is something that people often think of when someone's experienced a loss of a pregnancy or a loss of a baby. But really, a part of our goal is to normalize that there's a huge amount of grief that a parent has just at the time of finding out a diagnosis. You know, we grieve when what we thought was going to be the life and future is thrown off kilter, and there's a lot of unknowns. And so just normalizing that part of kind of the early grief experience, regardless of what the outcome is for the baby thereafter. And really in that, thinking about opportunities for legacy creation and bonding, even for babies who are expected, along with families' goals, to be able to go forward with interventions that may prolong their life for quite some time, thinking about sort of storytelling and making the most of the pregnancy and this really important time for a family, involving other siblings and other family members as well. And then also having that grief support, as I mentioned, after, if there is a loss of the pregnancy or of the baby. I just wanted to show a few of kind of the legacy creation items. There are things that I think have traditionally been done in hospital that are sometimes available after a baby dies. And so there are things in different hospitals and centers. There are different things that teams can bring to families. What we found is that prenatally, a lot of our families really appreciated being able to start doing some of this legacy work, even while their baby was alive. And their baby was safe in their tummy. And even if they knew that their baby actually would go to an intensive care unit after birth and may be stable for some time. And part of that, I think, was driven by the pandemic, and that pregnant patients were often coming to hospital visits alone. And so we created sort of these more portable memory making or storytelling kits so that families could actually take them home and work on some of these things if they wanted to with other family members. And then in terms of the Pediatric Palliative Care Team or PACT team support, really for families who opt to continue their pregnancy and where the pregnancy continues sort of toward the third trimester, we get our nurse practitioner and myself on our team involved to help just discuss further with family what their goals of care after birth are, and talk about how palliative care will or can sort of be integrated regardless of what's happening. So some of the babies we follow will get transferred over to the NICU at Mount Sinai or come over to Sick Kids for intensive care supports or surgical interventions. And we, as a PACT team, will continue to follow them given the high degree of uncertainty and the stress of having a baby who's in an intensive care setting where sometimes the outcomes are really unknown, especially early on. And then for our families who are proceeding with their pregnancy through to term, but are focusing on comfort after birth, then the Pediatric Palliative Care Team can be very instrumental in making sure that families understand their options for locations of care, particularly if the baby's surviving after those first, several hours, a couple of days when mom is often ready to be discharged from hospital, or thinking about where they want to be and how we can kind of optimize their comfort and the time that they're spending together. In terms of next steps, so just to give you a sense, we had about 107 families that we followed in our first 2 pilot years. We're now sort of halfway through our 3rd year of this program. And I think, we're always doing reflection and trying to figure out who are we missing in terms of our referrals and why might we be missing them. I think there are sometimes families where they experience a pregnancy loss or termination very early on, and some of them don't end up referred to us. So we continue to sort of advocate, particularly on the grief support side of our program, that we can be a resource for families, regardless of what the situation is and what happens. We hope to do some more evaluation about how patients and families think that we're doing, what aspects of our program are helpful, how do we continue to improve, and also for the other healthcare providers that we work with who interact with these families. Ultimately, I think our hope would be to be able to, once we have a sense of what is being offered in different parts of the GTA, to scale up kind of the support of our team, even if it's in a virtual sense for centers that are further away, so that we can continue to provide support to families if they're being seen at different hospitals. And then in sort of conjunction with that, to develop a bit of a toolkit and educational resource kind of portfolio so that we can help other practitioners who may be interested in supporting this kind of work but haven't done very much of it or haven't done it at all, to help kind of guide them through what we've learned and what may be helpful. I just wanted to briefly acknowledge our clinical team, many of whom I mentioned, and then we have other members in the pediatric palliative care community, and the Women and Infants Health Program community, who have all been really instrumental in supporting our work. And I'll stop there.
Yes, you can stop sharing your screen. Thank you so much for your talk and for really shining a light on this topic and creating this program. I did benefit from your team many years ago. You were not the impact team yet, but I had amazing support from Lindsay, who is in your team, when we did receive the diagnosis that one of our twins was not going to make to birth. And to this day, I'm so grateful because of her, we have memories, we create memories while we're still pregnant, something that I never even think about during that very critical time. And those are the things that we cherish today, because that's the only thing we actually have. So I'm very grateful for that. So my question to you is, if a hospital doesn't have a program or doesn't have much support for families, what is few simple things that they can do to support families in that situation?
Yeah, that's a great question. I think part of this comes from the comfort of having conversations with families about what their goals are and how to make decisions. I think one thing that I've learned is from families is it's not helpful to hear, here are your options, what do you want to do, but to actually take information in and get guidance along the way about what does this mean, what does quality of life mean to you, and some of those things to help families process this and not think of it as like a in the moment decision making. And so to support that, I think often there are often times where other hospitals will reach out for support around this sort of thing. And then I think the other piece in terms of tangibles would be the sort of development of a delivery, like labor and delivery care plan is really important. Even babies who are going to have certain medical interventions done at birth, we always want to think about that may be the case, and that may often be the number one focus of things, but how do we incorporate legacy building and meaningful moments with parents alongside that? And then of course, for babies where the focus is going to be comfort, then the delivery care plan really is focused on what is most important to this family, whether it's who they're able to have in the room around them, what's the environment like, what kinds of things to bring to the hospital. We have some things that we can always share with teams. So we can always share our sort of template of how we make a birth plan, and then people can pull out the parts that they think are helpful. And then I think the other piece is, depending on what the baby's diagnosis is, what do we expect from them after birth? And if the focus of care is comfort, do they have the right sort of support in place in terms of making sure they're comfortable, and how do we ensure that? And so that's also where kind of consultation from our team can come in. And certainly we do occasionally get calls to our PACT team from other community hospitals where families have decided they want to take a comfort focused approach and understandably want to deliver their baby close to home. And I think there's a lot we can do sort of working with families and with teams, especially now with virtual care, to support that to happen.
Absolutely. Let's talk a little bit about support for siblings and grandparents, because I remember the handouts that were given to us on how to talk to the sibling according to the age. Is this material being developed further? Because a lot of people ask us about what do we do with the siblings? How do we explain to the siblings? Especially during this time, if the baby is born alive, the sibling cannot even go to the hospital right now to meet the baby brother, baby sister, in whatever circumstance that is. So what is your approach to that right now?
Yeah, perfect. So I think one of the things we talk a lot with family about is how to plan to include siblings in this process and understanding. I think it's a very natural parenting reaction to want to shelter and protect kids. And I think how that sometimes plays out in these situations is that families don't want to explain to siblings exactly what's happening because they're worried that they'll be too sad and that it will really psychologically traumatize them. I think what we know now from years of experience and sort of research around this is that siblings, they just want to be a part of whatever their family's going through in some way. And so there's always developmentally appropriate ways to kind of include kids. I think the biggest tip we always give is to follow their lead. I think when kids feel like they can't ask questions because they're afraid that their parents will be upset, then they often won't ask questions. But if parents can create an environment, sometimes with support of other professionals, to say, this is what the diagnosis the baby has, even if it's big words that they don't understand, to start with small tangible things like that, and then take the child's lead about what they want to know and what they're worrying about. We're really fortunate now, I think, as compared with years in the past. We actually have somebody on our PACT team who does psychosocial support specifically directed for kids. So a lot of the work she gets involved with is siblings. And certainly in some of our perinatal cases, she's been happy to support families with some of that work with siblings, whether it's sort of meeting them directly or just helping parents through that process.
Oh, that is incredible. So, Dr. Roger, thank you so much for joining us here today. I'm very grateful to have you here sharing with us your work and this incredible work that you do for families. So thank you so much. And I hope I'll see you again very soon.
Oh, thank you so much for having me. It's truly my privilege. Thanks.
And we are going to be back now with Dr. Natalie Jewett, who will share how PACT continues to support families through the neonatal period. Dr. Jewett is a pediatrician with the Pediatric Advanced Care Team, PACT, Complex Care Team, and General Pediatrics Inpatient Service at the Hospital for Sick Children in Toronto. I actually had to pre-record her session. Let me just share here her video, because Dr. Natalie couldn't be here with us live today. But here it is, our chat. Dr. Jewett, thank you so much for joining us here today. Such a pleasure to have you sharing your knowledge and expertise.
Thank you so much for the invitation. It's a pleasure to be here.
Thank you. Dr. Jewett, let's start by talking what is palliative care, because we have this idea, but I know coming from you, we had this chat before, it is a little bit of a different concept. So talk to us about it.
Well, as you said, Fabiana, when people think about palliative care, people often think it just means death and dying. But as a palliative care specialist in the pediatric world, we really think that palliative care focuses much more on living than dying. We consider ourselves specialists in quality of life. And when we meet with families, we spend a lot of time figuring out how to make each day the best that it can be if life might be short. And so we do that by working really, really hard with families to incorporate more of the good stuff in each day and minimize some of the tough stuff. And so as a palliative care team, we meet with families that are faced with serious illnesses when a child might have a shortened life. But as I said, what we do is much more than just about death and dying. Although we do care for children at end of life, that's only a portion of what we do. And we spend much more time, as I said, about thinking about how to live each day to the fullest and what it means to live each day well, both for an individual child as well as for an entire family. Sorry, go ahead.
No, go ahead.
I was going to say our team used to be called the Palliative Care and Bereavement Team. And we actually changed our team name to PACT, which is an acronym that stands for the Pediatric Advanced Care Team. And we changed our name just for that reason, because when folks often think about palliative care, they think of just death, and we are so much more than that.
So how do you train the staff in the hospital to change a little bit of this concept and the way we see it?
That's a great question. So we actually usually tell other teams in the hospital that they could introduce us just by our acronym PACT and say that they're a team that focuses on quality of life. We also use the word supportive care a lot more frequently than palliative care. And when we talk to families about what we do, or when we talk to other medical providers about what we do, we often talk about the fact that we don't replace a primary team or a primary doctor or nurse, but rather are there to provide an extra layer of support for children and their families when they're faced with a serious illness. And sometimes when we start that way, we get a foot in the door and then have an opportunity to talk about more about how our team can support families, as well as have an opportunity to talk about some of the tough stuff. But oftentimes, as I said before, when we were just called palliative care, the conversation would end there and families didn't typically want to meet us. And so we've been really thoughtful about changing our team name, because we do know that after families meet with us, most families are very grateful for our involvement, and we wouldn't want to have the door closed on us before we have an opportunity to step in.
Absolutely. I feel this is such a great approach, because then I feel that you change the family's perspective, right? How can we have a quality of life if the life is going to be short and we have some limited time with that child? So I feel this is such a beautiful approach and so supportive for families. So congratulations on this work. I think this is really incredible and very much needed, not only in childcare, but maybe extend this to adult care as well. So I think my next question to you is, how do you support families once they are in your program, part of your team? So how do you provide support to the families?
So we support families in a similar way that Sarah might have talked about, or Dr. Lord might have talked about when she described the IMPACT program. So after a child is born, we spend a lot of time getting to know families and understanding what their overarching goals of care are for their child. So we first really want to get to know, what does a family value? What is most important to them? We ask a lot of questions of parents and children when they're older and able to articulate their feelings, specifically what they're hoping for. We also talk a lot about what families are worried about. And so once we understand a little bit more about who a child is and who their family is, we work really hard with families and with the primary medical teams to ensure that their overall plan of care is aligned with what's important to them. So what does that actually look like in reality? So sometimes we will hear families talk about that they really want their child to spend as much time as possible with family and to be at home, even when they're faced with a serious illness. And so we work really hard in the hospital to ensure that we're able to incorporate family time where possible. We also will work hard to advocate for a child to go home as soon as possible, if that's something that a family feels is important. Other times families will talk about their biggest fear or worry is that when their child has a serious illness, that they will suffer. Specifically, they'll suffer from symptoms of pain or breathlessness. And so our team works really hard, again, in conjunction with the primary team. So if it's in the NICU, it would be with the NICU team, to ensure that a child is not experiencing those symptoms of pain or breathlessness. And so our team will work with the teams to use medications or other modalities to help manage symptoms if they come up. I've talked a lot about sort of our team as generally, but it's probably important to know that our palliative care team, or our PACT team, is composed of doctors, nurses, grief support counselors, as well as a nurse practitioner. And then we have another individual on our team whose role is in psychosocial community support, who specifically works with children and their siblings. We also partner with other experts in quality of life. So in the hospital setting, this includes a massage therapist, a music therapist, art therapists, and therapeutic clowns. And so we work with these other individuals, again, to find ways to ensure that each day is the best that it can be. And so those other individuals might improve each day by making the hospital feel less like a hospital, if that's what is important to a family.
That is amazing. So my question to you is, you talk about the family time. So in this last year and a half, there's so many restrictions in the hospital. So how are you managing to provide family time during this time of COVID and family restrictions in the hospital?
So I have to say, working in this area during COVID has been one of the most challenging times for sure. Because as I've said, so much of what we do is about bringing families together and finding ways that even when a child is very sick, that they can make memories and be together. And so COVID has forced us to become incredibly creative in ways that we could do that. So as restrictions opened up in the world and we were allowed to have outdoor gatherings, we actually had probably one of my most memorable encounters with families. We actually had a few different families meet outside of the hospital in some green space. So we had one little one where a family had talked about how important it was to introduce their daughter to the family or their extended family, as well as to meet a family dog. And so we actually organized an outdoor event because we wanted to ensure that we had we're doing everything within COVID guidelines, but we're able to get the little one outside with medical support. So we had an RT, a nurse, a doctor, and everyone with them, but got them outside to meet with family and to see the family pet, which was really, really special. We also get really creative in terms of finding ways for children to find connection with family outside of the hospital. And this is within COVID and outside of COVID as well, where we do a lot of things where children can hopefully still feel the connection of their family. So we talk a lot about connection between siblings, and we'll have brothers and sisters bring in artwork so that it's decorating the bed spot in the NICU or decorating the bed spot in the hospital. We do a lot of work with connection stuffed animals, where we will give the child in hospital a bear and then give a matching bear to the brother or sister at home, and talk about when you hug the bear, your brother or sister has the same animal close by and so can feel your hugs. So we find ways to still get in-person connection, but then also get creative in other ways as well.
That is so great, and I hope many other hospitals follow these ideas because they are so important. You mentioned siblings a couple of times, and I really want to talk about siblings. What kind of support do you provide the siblings? Because especially now that the sibling cannot always be present and together all the time. So how are you bridging that gap, and how are you supporting the siblings?
So I mentioned that our team is filled with lots of different experts. And one of our team members, her name is Shandy Alexander. She trained in grief support, but also did training in child life. And so her title now is as community psychosocial support. And specifically, her role is around supporting siblings. And so she does this by setting up dates with siblings, either in hospital or out of the hospital, or on Zoom. She's gotten really creative in COVID, and she represents someone that's just there for them. And so she talks a lot with brothers and sisters about how their brother or sister who has a serious illness has a whole team of doctors and nurses, but she's there for them and she's their person. And because of her training in child life, she has very creative ways to connect with young brothers and sisters, where she'll start off with a game. So if she's in a backyard, because she's done backyard visits during COVID, she'll sit and do sidewalk chalk with the sibling. And as they're doing sidewalk chalk, she'll talk a bit more about sort of what's on their minds, and is there anything that they were wondering about or worried about. And she really follows a brother's and sister's lead in terms of how much they want to know and how much they don't. And she's got fantastic handouts, actually. That's one thing I'll ask Fabiana if I could share with you about sort of different strategies she uses with brothers and sisters, and things that she talks about. And so she talks a lot about the importance of naming the illness and using medical terminology, because we've learned over the years that sometimes when you just say your brother or sister is sick, that sort of general word can be scary to children because they don't know how that sick is different from a common cold. And they might worry that if they get sick later with a cold, that they'd end up as sick as their brother or sister in the hospital. And so she talks a lot about the importance of language. And then she's got a whole thing on she has a list of C's and W's that I'll share with you, but important messages that she shares with siblings about the fact that they didn't cause the illness, and that they can't catch it. And anyway, it's a great resource. I could talk the entire time about it. But so Shandy, as I mentioned, specifically is around to connect with those brothers and sisters, and can do that in a way that's age appropriate and developmentally appropriate.
Oh, that is so great. I would love to share that resource with our families, because I think this is such an important piece on how to support the siblings and what is age appropriate and how can we talk to them. I think my next group of people that I wanted to address are the grandparents, because when the parents are in that situation, you're so overwhelmed with emotions, and you're trying to deal with all the situation plus taking care of the child, and the grandparents are lost. Like from my own experience of losing a child from a stillbirth, I didn't know how to support my parents or even how to talk to my parents or to my in-laws. And I feel they suffer as much as we do as parents, because they suffer for us and for the grandchild. So how can we support them better?
So I think that that's such an important question, Fabiana, and is why when we first meet with families, we spend a lot of time trying to understand the family tree and who is part of a child's circle, because we know that it affects everyone involved. It's not just the child who's dealing with a serious illness. It's not just the parents, it's grandparents and aunts and uncles and cousins. And so we ask a lot of families when they're in hospital about who is important to them when it comes to making bigger decisions. And so some families will even say, you know, my mother or my father, I want them to be a part of these bigger discussions. And so we actually will include them as much or as little as feels right. So sometimes we'll have a family meeting with grandma present or grandpa present, and provide an opportunity for them to ask the medical team questions, because we know that it's really, really hard to have to translate all of the information that you're taking in at the bedside to everyone else in your family. And so we want to provide opportunities for families to, again, have that broader circle as involved as much or as little as possible. So first, as I said, we get them right there in the moment in meetings, if that's helpful. And then beyond that, we talk a lot with families about there's the communication piece about what's going on, and figuring out if there's a certain person in their family that they think would be a great spokesperson as to what in terms of information sharing. And so sometimes that could be a grandparent. But then there's also the involvement of extended family in the ways that we talked about already, about ensuring that a child has an opportunity to make memories and live their life as part of that larger family context. And we try to include grandparents in all of those moments as much as possible. So if it's important to have grandparents present just for visits, we work really hard to get visitor exceptions when we can, recognizing COVID is hard, and then incorporating them into whatever ceremonies might be important to families as they go. So again, it's something that we try to understand from the beginning, who's part of this family unit and who's important, and then find ways that make sense for them as a family to have them as involved or as not.
Absolutely. So you mentioned decision making. So how do you support families around decisions? Because I feel this is a very, very tough position for families when the decision time comes. So how do you support them around that?
So we will go back to what are a family's goals of care for their child, and again, what are their values and what's most important to them. And so we spend a lot of time sort of thinking about what is an overarching goal for a family when we first meet them. And then as decisions come back, we'll always come back to those goals. Sometimes I find as medical providers, we get so bogged down in the details of, should we do this test or this technological intervention, whether it's a feeding tube or breathing machine. And sometimes we forget to step back and say, what do we actually think makes the most sense for this child, given what's important to the family? And when we sort of zoom back to a family's goals of care, those little decisions are much easier. Because if it means having significant technological support that would require 24 hours of nursing a day, and the family wouldn't be able to go places that they want to take their child, then that decision actually becomes easier. And so again, we go back to, is comfort most important? Is being together as a family or at home most important? And then use that as a philosophy to make those smaller decisions. I think sometimes, again, as medical providers, we see blood tests and investigations that we do, like x-rays or CT scans, and there might be a medical fix to fix the blood test, to change the number. But whether or not using a breathing machine to fix that number makes sense for that child's quality of life might not be the case. And so we always try to, again, step back, take a moment to have a conversation with family about what they really value, and then come back to the medical team together. So sometimes we sit in with the primary team and bigger multidisciplinary teams when it comes to those decisions. And sometimes we're in the background just as a sounding board for families to talk about those decisions.
Oh, okay, so let's talk a little bit about memory making, as you had mentioned before. And when we are in the ICU, the child is in an incubator. So what are the possibilities for that, or suggestions that you have for the family to create memories? Because sometimes we don't even think about it. Because I remember when I had the stillbirth, the nurse came and said, "Do you want to take a picture with your baby?" It never ever occurred to me that I could do that, or I was even thinking about taking a picture. And I really cherish that photo today. It's the only one I have. So how do you make recommendations or suggestions once you understand the family's values or what is important to them, or what can they do to create those memories?
I'm so glad, Fabiana, that nurse had made that suggestion to you, because I think sometimes our suggestions are just those typical things you would do with a baby after they were born to celebrate their life, that sometimes in the intensive care setting doesn't occur to the bedside team or the family when you're dealing with such serious medical illnesses. So a lot of our suggestions are simple ones. So doing family photos. We work with a photographer in the hospital who's a professional photographer and incredibly talented, and has a way of taking pictures, even if a child is intubated or in an incubator with machines or feeding tubes, finds ways to take a photo that reflects the family and the person and doesn't focus on the technology. We also talk about doing sort of typical baby stuff, like having an opportunity to do a bath, might seem like a really simple thing. And sometimes people think, oh, we could never do that in the intensive care setting, but the nurses are incredible and the team is creative, and we can find ways, again, just to give your child a first bath, or get things that are important to the family at the bedside. So whether it's a piece of clothing or things that are important to them. We do a lot of sort of legacy creation activities that I'm sure you've heard of, doing handprints and footprints that can be put into frames, as well as we often will do hand molds as well, or foot molds. We do, again, just try to make events great memories, even being in hospital. So at Sick Kids, we have a place called Samsung, which is it's a rooftop patio. So having events that is a nice memory where a child can feel the sunshine on their face for the first time. And again, even if they're in an incubator on a breathing machine, we do it, and we find ways to make it happen. We always want to be safe, but if it means going up to the rooftop lounge with a team of 10 healthcare providers, we've done it, because I've had a family say my child's never seen the sun or never felt the sun or felt the wind. And so those little moments, I think, are really important.
Well, I actually, when I was at Sinai with my son in ICU, a baby got transferred to Sick Kids, and the mom actually asked the Sick Kids team to have the baby outside to see the sun for the first time. And I remember that conversation, and now that you brought it up, and it is possible. I think that it obviously, as you mentioned, takes a big team to make it happen, the medical team, the social support team, but it is doable if there is a willingness from the hospital parts to make happen for that family. I think this is such a great message, and things that families remember forever. Right? These are the moments that, yes, we go through these hardships, but there is those moments that a lot of people made that happen for our family. Then comes that place of gratitude from the families towards the hospital. That's how I feel anyway. But let's talk a little bit about location of care at the end of life. We had discussed this prior to our interview today about withdrawal from technology. So when that happened, what are the options there?
So this is something, again, we always go back to what a family tells us is important. And sometimes when a child has a serious illness, families haven't even considered the possibility that their child could leave the hospital. And so if a child is dependent on a breathing machine, again, in those situations specifically, families will think, well, we could never leave the hospital. This is where we need to be. But we talk with families that we think of sort of three broad categories of where care could take place. If a child has a serious illness that we do sadly believe will lead to their end of life, we really work hard to ensure that that location is where would be most meaningful for the family. So we talk about families staying in hospital, and if that's the choice, we again work really hard to ensure that we can make memories and ensure that they have family present if that's what is important to them. We also talk about bringing children home for end of life care, and we work really hard with teams in the community to ensure that we're still able to manage symptoms and support families through the end of life process in the home setting, if that's what they choose. We also have a third option, which we kind of think of as in between the hospital and the home setting, which is a hospice setting. And so specifically, we work closely with Emily's House, which is a pediatric hospice, just about a 10-minute drive from Toronto, or from Sick Kids in Toronto, which is housed or is staffed 24 hours a day by nurses who can provide care, but it also is a home-like setting where we would have had entire extended families present for their child's end-of-life care. And so we have these three sort of different options. And again, we can get creative to make a location of care that's most important to a family happen based on their wishes. So specifically, we talked about when a child is dependent on breathing support, and the team is worried that after that breathing support is removed, that a child would die shortly after. And so there are ways that we've again gotten creative and supported families to have that breathing support removed in the home setting if getting a child home to see their bedroom for the first time, or to just be together with the family is important to them. So we work really hard to figure out what location makes the most sense.
Absolutely. So my question is, how about the hospital that don't have your team? What can they do? So you talk about sometimes small nurseries or families who are in very remote areas in Canada. So how can your team has any support to these hospitals? Or if you don't have that particular piece, how can other hospitals create the same experiences for families?
So the model in Ontario for pediatric palliative care, we really think of as a sort of hub and spoke model. So in the academic centers, or the hospitals like Sick Kids, for example, or McMaster Children's or CHEO or London, in those bigger tertiary hospitals, there typically are teams like ours that do this sort of work. As you get into smaller hospitals and smaller communities, obviously there's fewer specialized care providers, but we often partner with care providers that are local to a community to provide sort of backup support and talk about strategies that we would use if a child was in hospital, or for example in the Toronto area, and how to employ those strategies at home. And so it's a complicated network, but the short answer would be if a family was born in Northern Ontario and in a small community, and the family wanted to stay in that community for their child's care, the healthcare providers that they work with could always call one of the teams at the tertiary center or the academic hospitals, and we would find a way to support them over the phone or through Zoom. That they're able to deliver the type of care that is most important to the family. Yeah.
Okay, I think I just want to go back a little bit about the traditions and the memories that families created, because we live in this country. There's so many different cultures and traditions. So how are we providing particular care for different religions and beliefs. Like, let's talk about, for example, indigenous families that they have this smudge ceremonies. How are the hospitals including every tradition and belief and make sure that family is supported that way?
So again, when we first meet with families, we ask these questions to get a sense of what is their own belief system, what is their culture, what are their religious beliefs, and is this something that's important to them? And then based on what a family says, we work really hard to make it happen in the best we can. So you mentioned specifically in Indigenous cultures, the importance of a smudging ceremony. And so we have had families that was important to them, and we have been able to have smudging ceremonies within the hospital. In terms of other specific religious beliefs, we work closely with the spiritual care department at Sick Kids to ensure that ceremonies like baptism are able to happen in the hospital setting. And if one of the individuals on the staff in the hospital isn't specific to the religion that an individual believes in, we have had faith leaders come into the hospital if it's someone, again, that would be important to the family. Mm-hmm. So we ask the question about culture and about religion intentionally because we recognize that when someone is faced with a serious illness or facing end of life, that these ceremonies are really important and work hard to incorporate them the best we can.
Absolutely. That's great. So I think just to wrap it up, what is the role of your team if the baby dies?
So if a baby does die after we've met with a family or even before, we continue to stay involved with the family. So I mentioned on our team that we specifically have a few team members whose role is in grief support. Mm-hmm. And so we work with families at the time of death to ensure that they're able to organize funerals or ceremonies that are important to them at that time, and then continue to support them after. So our grief support coordinators continue to check in because we recognize that after the loss of a child, there's a lot of emotion and a lot of difficult challenges ahead. And so our team doesn't go away, and we continue to follow and continue to check in as much or as little as a family wants. And then the grief support coordinators on our team continue to have memorial events for families after the loss of a child. So there's various ceremonies that happen at Sick Kids that can be specific to the unit or across the hospital, such as a candle lighting ceremony to honor the memory of a child after their death, or a butterfly release ceremony that they also do. And then they've also created different opportunities for parents who have dealt with the loss of a child or are dealing with the loss of a child to connect and support each other. So they have coffee clutches where parents get together. There's an art night and different ways, I think, both in person and on Zoom now with COVID, that the team really works hard to provide ongoing support. Because we've heard from a lot of families when a child is critically ill, the hospital in many ways becomes their family, and they have this whole group of people that after their child dies, it feels really hard to not be connected with them anymore. And so our team, we hope, is the exception to that, and that we continue that connection over time.
Absolutely. Thank you so much, Dr. Jewett. One last message for healthcare professionals or parents watching us here today.
My final message, what would it be? I would say, don't be afraid of the term palliative care. I promise if you get to meet someone from our team, you might realize that we're not just about death and dying, and that our focus, again, is on living. So give us a chance. We'd love to meet with you or anyone who needs any support.
Okay, Dr. Jewett, thank you so much for being here with us today. Such an important day as we talk about pregnancy and infant loss, and I'm very grateful for all the work that you do. So thank you.
Thank you so much, Fabiana.
And thank you all of you being watching us here today. Our last chat of the day is with Michelle Lafontaine, who will talk about the Pregnancy and Infant Loss PAIL Network, the programs offered by the organization and why awareness is important. She will also share information about the International Wave of Light. And I have here with me, joining live from Toronto, Michelle, who is the program manager at PAIL Network. Michelle benefited from support provided to her and her family by the organization after the loss of her twins in 2005. Michelle is devoted to helping families get the support and resources they need to learn how to incorporate the loss of a baby into their lives in order to find hope. Professionally, Michelle has more than 15 years of related experience coaching and working with families in various capacities, and was instrumental in the development and advocacy around passing the Bill 141, Pregnancy and Infant Loss Research and Care Act in 2005. Michelle, thank you so much for joining us here today. It's such an important day. I know you are very busy, so I really appreciate you being here today, sharing a little bit of your work and what your organization provides to families.
Thank you, Fabiana. I'm so happy to be here again with you this year.
Thank you. And for all of you watching us live, Michelle, we're going to have a short presentation, and then she can answer any question you might have. So you can just pop the messages on our box.
So thank you again for that nice introduction. So I am Michelle Lafontaine, and I have the pleasure of serving as the program manager for the Pregnancy and Infant Loss Network. We are part of the DAN Women and Babies program at Sunnybrook Health Sciences Center. Next slide, please. So just to give you a little bit of background about what PAIL Network is and what we do, we have actually been around for over 25 years. PAIL Network began as a nonprofit organization created by bereaved parents who realized that there were not many resources available for them after their loss. In 2015, Bill 141 was unanimously passed in the House of Commons. This bill was presented by my MPP Mike Cole, and it enacted the Pregnancy and Infant Loss Awareness, Research and Care Act, which mandated research to be undertaken and programs to be developed for pregnancy and infant loss. It also proclaimed October 15th as Pregnancy and Infant Loss Awareness Day. We became part of Sunnybrook Health Sciences Center in January of 2017, and as our mandate is provincial, we reached throughout Ontario. Personally, the experience of loss for me was isolating and devastating. We left the hospital after receiving excellent medical care, but did not receive any information about where to go or what to do next in terms of support. I didn't receive any follow-up from my family physician or from my obstetrician at the time, and went back to work far too early. And it wasn't until a friend of a friend who knew someone who had a loss connected me with what was then called Perinatal Bereavement Support of Ontario. And we began to see other families who had experienced a similar loss to ours. And it really helped me to feel like there would be a future for us, that we would be able to experience joy another time. Next slide, please. Pregnancy and Infant Loss Network, we offer peer-led support at no cost for any family in Ontario who's experienced a loss. Pre-COVID, we had mixed loss community circles of support about once a month. In some areas, they were offered twice a month in person. Now, all of our groups are online. We offer this online support using an encrypted private connection, and we offer families the option to use their video and audio participation because there is also a chat feature. So sometimes families aren't quite ready to share, but just want to listen, and that's perfectly acceptable as well. We have mixed loss and loss-specific groups that are based on types of losses. And you can find all of that information on our website to see how often they're meeting and when they meet. The in-person talking groups were really where people were sharing their story, hearing about the experiences of others. And these groups are open. So that means there's no start date or end date, there's no waiting list, and people can join at any time after they've completed a request for support with PAIL. Some people come for months, some people come for years, and some may stop back in from time to time during difficult bereavement milestones or over the holidays, for example. We also offer one-to-one phone support where we're able to match a peer support volunteer with a family based on their experience with loss. So, for example, if you experienced a termination of pregnancy, then we would be able to match you with another volunteer who has also had a termination of their pregnancy. We do offer support for families who are pregnant after a loss. We know that you're still grieving when you're pregnant, and that pregnancy it brings with it new fears and anxieties, along with that hope for a new baby. We know that seeing a pregnant person in group can be very triggering for bereaved families, and we also know that pregnant people are often not comfortable being in a group with a growing tummy. Families can register for a 6-week period, but they can stay in the group for as long as they like. Next slide, please. We have free brochures for any family and any healthcare provider across Ontario, and we do offer booklets at no cost to families. Healthcare professionals can order these booklets. They're $1 per booklet, and we can ship them out to healthcare professionals directly. If you are joining us from outside of Ontario, then you're, of course, welcome to access our website, which we'll be showing to you later. And inside of Ontario, then we can send these to you directly, and they're available on the website for you to download as a PDF. We currently have booklets about a miscarriage, pregnancy after loss, supporting siblings, stillbirth, infant death, and termination of pregnancy. Next slide, please. In addition, we have some web-based resources for families. This one was something that was created by and for families, and it's called Helping Others Understand Your Grief. Often we were hearing from families that they were not receiving the support that they were hoping for from friends and family, and it felt very burdensome for the bereaved family to have to try to explain to somebody else what was helpful for them, what might not be so helpful for them, and the support that was really going to be beneficial. We also have a resource for grandparents. We know that grandparents, as was discussed, they are often described as experiencing a double loss as they are grieving the loss of their grandchild and also witnessing the deep pain and grief that their child is feeling. We're currently working on some additional resources and support groups. We have parenting after loss that will be coming up, loss of a multiple, grief literacy information so that families will be able to see themselves and understand better about what they might be thinking, feeling, and experiencing after the loss of their baby. Trauma and grief. The statistic is that 87% of families experience their pregnancy and infant loss as a traumatic experience, and many families are diagnosed with post traumatic stress disorder after the loss. And it's really important to receive the kind of help that you need to manage that trauma. And lastly, we are about to launch a group in the coming weeks for partner grief. So this group will be for the non-pregnant person who experienced the loss to join with others who are often overlooked and their grief becomes invisible. We've heard from many, many partners that during their healthcare experience, they weren't even addressed in the room, and that afterwards, people were quite worried about their partner and would ask, how is she doing? How is the family? But really didn't ask them about their loss. So we're very pleased to be able to bring this to fruition. Again, that group starts the week of October the 28th. If you're interested in joining them, please go to our website and complete a request for support, and you'll be able to join that group as a partner. Next slide, please. The next part of our program is healthcare professional education. And through this, we are able to offer compassionate care workshops. That is a full day learning experience for health professionals across Ontario that, again, is at no cost to the professionals. We have some videos on our website that have been very helpful in terms of understanding from our family's perspective what is helpful and what has been hurtful in their healthcare experiences. On our website, we hope that it's a user-friendly section for professionals. So when you're caring for a family, you can go to our website at pailnetwork.ca and instantly get the information that you're looking for. Some of it is for professionals themselves, but there are some downloadable, printable resources that you could then access to give to the family in the moment. We are a part of interprofessional education for students, and we also are working on some webinars that we'll be able to publish on our website. All of our resources are easy to use, downloadable, up-to-date, and evidence-based. Next slide, please. So this really brings us to why we are here today on October the 15th, And this is really a big, big part of our mandate, which is awareness and advocacy. So this year, like other years in the past, we have been distributing pregnancy and infant loss awareness kits. You can see I have one of the buttons here, but we also are inviting families who have been able to access these kits to wear and share publicly. There are jacket buttons, there were lapel pins, a vinyl cling decal, a notepad that was some plantable seed paper for you to write messages to your baby and plant them in the ground, and also some beautiful butterfly tissues. We will continue distributing these kits throughout the year. And so if you weren't able to get one before today, then please feel welcome to order one through our website, and we can still send them out to you, to anybody in Ontario. We have kits for families, and we also have separate kits for professionals. Really, by participating in the awareness campaign, our hope is that more conversations around pregnancy loss and infant death will be had, and that more bereaved families will be heard. We feel so strongly about opening this conversation. We were so fortunate to have the Unsilence the Conversation event and advocacy work donated to us. And so, again, on our website, you'll be able to find videos and more information about how to get the language that families are often lacking to try to describe what this experience has been like for them. Next slide, please. Today is October the 15th, and that means that today is the Wave of Light. So all over the world on October the 15th, people light candles and leave them burning from 7 p.m. until 8 p.m., and that creates a 24-hour global wave of light. So whether you're joining us today as a parent, a grandparent, a sibling, any relative, or a friend, we welcome all of you to join together to bring this little bit of light into an otherwise very dark world. PAIL Network has a virtual ceremony that we'll be offering this evening. You're welcome to join this ceremony for us, to share your baby's name during the ceremony. And oftentimes there are events that are happening in your community. Part of what we have been able to do as well is to have different monuments throughout the province lit in pink and blue and purple. And so please look to your local municipalities. The CN Tower will be lit tonight. The Niagara Falls will be lit tonight. And I know that there's events happening in Newmarket, in Toronto, and in various places. I believe Peterborough has one this evening. So please feel welcome to go to our website. You'll see all of that information on our calendar of events. Next slide, please. Lastly, I think the biggest question that is posed of us at PAIL Network is how can I help and what can I do? I know someone who this has happened to, or I want to be able to help my sister or my brother, someone that you know. We know that 1 in 4 pregnancies will end in loss. And so the number of people that are affected by this type of loss is astronomical. The reality is that there's nothing that you can do to bring their baby back. You can't fix this for them, but what you can do is be present with them, listen to them, allow them to have a safe place where they can talk about their baby. As humans, we often are looking for the right words to say to be able to fix what is going on. And so we put together this list to really demonstrate that what we're looking for is presence, not perfection. And there is really a gap that exists between what is said, the intended message of the person who says that thing to you, and the received message of the person who hears that. Something that really hit home for me was when people would say to us after our loss that everything happens for a reason. And for us, that's at the top of this list. And I think the intention of someone saying everything happens for a reason is that I want you to find meaning in this. I want you to see what there might be as a lesson in this. And really what I felt was, I can't imagine any reason that there would exist for me to have to grieve the loss of my 2 babies. The other thing that we like to give in terms of recommendations for how to support a family is to keep in mind that most things that start with the words "at least" will often feel very diminishing and invalidating to a family. And so families will hear, "At least you have other children, at least you know you can get pregnant, at least the baby wasn't very old and so you didn't know them for very long, And those are things that have just really time and time again been shared with us as things that are increasingly hurtful to families, and that they really just want you to come be with them with no expectations of how they can do that. For me, I know that knowing that my friends and family are also lighting a candle for us tonight between 7 and 8 is extremely meaningful. Whenever we're able to celebrate those milestones in our bereavement and know that our babies are being thought of by our friends and by family members is just so important and lets us know that they won't be forgotten. Next slide, please. So, what I'd like to end with today is really an invitation for you. If you're looking for support or you know someone who would look for support, just remember that you are not alone. There are many, many other families that have experienced this type of loss. We are here for each other. And at PAIL Network, the peer support that we offer, it really allows for us to walk beside you. We know that each person's grief journey is unique to them, and that work needs to be done individually, but you can do it in the company of others. Thank you.
Thank you, Michelle. You're doing such a great work and such an important work. And I'm really looking forward to the next booklets. There's so many topics that you're addressing. They're so very important. And I hope people took a screenshot of what to say and what not to say, because it's very important. I heard so many of those, and some of them still got stuck in my head. Michelle, one question, because it is Pregnancy and Infant Loss Awareness Day. Why do we need the community at large to know about this, and why do we need to continue to raise awareness on this?
I think the awareness is so important for families who go through this experience to see themselves reflected in the world around them. You know, after we experienced our loss, no one was talking about this. Nobody was showing this on TV or in a movie or in a book or anything. And so the message that we got was, if you don't see it, then you shouldn't be talking about it. And so that silence was absolutely deafening for us. What we hear from families is that they also didn't even know that this was something that could happen to them in their pregnancy or in their life. And so the shock that happens when you think you're a healthy person, you think that you're having a healthy pregnancy, and then when something goes wrong and the baby dies, you have to really kind of process your shock and the trauma before you can even access the grief. So we often say that in the same way that people know that the Cancer Society exists, for example, even when you don't have cancer, families should know that pregnancy and infant loss exists, even if you haven't experienced it yourself.
That is so important. Michelle, one last question for you. Can you talk a little bit about your Unsilence the Conversation campaign? Because I think such a powerful campaign, and I think so many of us should be aware of it. So let's
Yes, thank you.
about that.
So the hashtag Unsilence the Conversation campaign brought with it the unbirth announcement. And this was something that families were able to share on their social media platforms. And it was a video that really helped to provide some language to what this person may be experiencing. And the purpose of that campaign was really to bring forward those conversations, to allow people to share their experience despite feeling like, I don't know what to say. Maybe you haven't even told someone that you're pregnant, and now you have to tell them that the baby has died. And so unsilencing the conversation allows families to, with the click of a button, show an image on their Instagram, share that video and invite people to talk with them about that and to extend their support. And any way that we have to take the burden off of the bereaved person to seek support is, I think, time well spent. So this awareness campaign was really important. It's not tied to any time of the year. It's hosted on our website and any of the major Twitter, Instagram, and Facebook. If you search Unsilence a Conversation, you'll find all of the information that you need there.
Thank you so much, Michelle. And to all of you watching us at home or in the hospital, tonight, 7 o'clock, no matter which time zone you are, from 7 to 8 o'clock, you can light up a candle in honor and in memory of all those babies that were gone too soon. So, Michelle, thank you so much for joining us here today. Always a pleasure talking to you, learning from you. Your work is truly inspiring, so I'm very grateful. Thank you.
Thank you. Thanks, Fabiana.
And to all of you watching us live today, thank you so much for joining us here today. The video of today's session and all the videos from our live series are available on the CPBF website, which is right here, the CanadianPreemies.org. And I want to thank our sponsor, AstraZeneca and Water Wipes, for their ongoing support to our education sessions. And we are a charitable organization, and we believe that through education and support, we can empower families, ensuring they are ready to care for their premature babies. Visit our website, consider making a donation. Together, we can create a brighter future for all our families. And I see you again next Friday, 1 p.m. Eastern Time. Stay well.